So good morning students. Today we'll discuss the spinal cord, external features and internal features. So this spinal cord, it is extension and continuation of the medulla oblongata after crossing to the foramen magnum, below the foramen magnum 2 up to the disc between the L1 L2. The spinal cord is extends. Otherwise we are also called the superior margin of the atlas to lower margin of the L1 vertebra. That is the extension. The cord which is extending from the medulla oblongata enter into the vertebral column. This is covered by the spine of the vertebra. That's why we are calling the spinal cord. So the length is the 45 centimeters in length in males, 45 centimeters in length from here to here, 45 centimeters in length in males, 43 centimeters length in females. Next, what are the coverings to the spinal cord? After removing from the vertebral column, immediately we are finding the spinal cord covered by the coverings. So these are the coverings. See this is the outside to inside. We can identify the outside to inside. Dura mater, arachnoid matter and pia mater is there. So between this space, subarachnoid space filled with the cerebrospinal fluid. These are the meninges covering and continuation from the meninges of the cerebellum, medulla oblongata. Where is the dura mater having the two layers in the cranial cavity, you know, that is the endosteal layer and meningeal layer. But that meningeal layer only continuation as the dura mater of the spinal cord. Inside this, after separating this, we can identify the two layers, that is the arachnoid and pia mater. Very difficult to separating, like see how the dura mater is separate, but whereas the arachnoid and pia mater is very difficult to separate from the spinal cord. See here the very shining color. See here, see I can show, which you are seeing here, the white color appearance is there, that is the pia mater. This is a pia mater. See here also we can identify the, see, this is a pia mater extension. See this also. So very difficult to separating, like the dura mater is very easy to separate, but arachnoid and pia mater is either into this spinal cord. And after remove this meninges, immediately we can identify the anterior and ventral and dorsal root of the spinal nerves. Ventral and dorsal roots of the spinal nerve. See here, this is the one root of the spinal nerve. Another one is the dorsal root of the spinal nerve is there. Next, and also here we can identify it is not look like a same cylindrical upper part. From here to here is the cervical region. It is cervical region. From here to here, this is the thoracic region. From here to here is the thoracic region. From here to here is the lumbar region. Next is the sacral region is there. But here we can identify the cervical region and lumbar region enlargements are there. Cervical region enlargement, that due to the formation of the brachial plexus, that's why this region is enlarged. Next, whereas the lumbosacral region, lumbosacral plexus forms that going to supply to the lower extremity. That's why we are identified spinal cord, this lumbar region enlargement is there. Whereas here thoracic region very narrow and cylindrical is there. So because it is going to supply only intercostal muscles, so that's why the size of the spinal cord is very small size. But whereas here the cervical region, brachial plexus formation that going to supply to the upper extremity, that's why the spinal cord is enlarged. But whereas the lumbar region also enlargement is there due to the formation of the lumbosacral plexus. These are going to supply to the lower extremity. Next, and also the spinal cord here end of conus part. This is called the conus medullaris. See, I can show here conus medulla. I am separating the lumbosacral plexus between this. See here, this is the conus medullaris. Conus part of the spinal cord, conus medullaris, which is a continuation is there. This is called the phylum terminale. See, this is called the phylum terminale. These are the bunch. This bunch is called the cauda equina. This bunch of the nerves, these are called the cauda equina. Cauda means tail. It is look like a horse tail, small horse tail. That's why we are calling it is a cauda equina. This is a phylum terminale. This is a conus part of the spinal cord. This is the lumbar enlargement. This is the cervical enlargement. Next here, the 2 points to remember. One is the pyometer modifications, like one is the ligamentum denticulatum. See here, white color, it is a saw teeth type, it is there, that is the ligamentum denticulatum. See here, it's ligamentum denticulatum. Why we should give the importance to know this ligamentum denticulatum? This ligamentum denticulatum, saw teeth type, white color appearance is there. This ligamentum denticulatum separates the 2 roots of the spinal nerve. One is above the ligamentum denticulatum. This is the ventral root of the spinal nerve, and behind this ligamentum denticulatum, that is called the dorsal root of the spinal nerve. So after piercing this, we can identify the outside. This is the spinal nerves. This is a spinal nerve. It is passing through the intervertebral foramen. Next, the blood supply of the spinal cord. Here, see the blood vessels, how it's going to supplies to the spinal cord. This blood supply is mainly anteriorly supplied by the anterior spinal arteries, posteriorly supplied by the posterior spinal arteries. See once again how the spinal cord. Now the TS of the spinal cord. See how when you take the section of the spinal cord from the cervical region, from the thoracic region, from the lumbar region. So the arrangement of the gray matter and white matter is there. In the spinal cord, gray matter is present in the centrally H-shaped arrangement is there. See here, this is a H-shaped arrangement. In the centrally H-shaped arrangement is there, whereas the outside is the white matter. This is the white matter. This is centrally gray matter is there. So this is the part of the spinal cord. The part of the spinal cord which contain this is the dorsal root of the spinal cord. This is the ventral root of the spinal cord. These 2 roots are united together to form a spinal nerve. This is a spinal nerve. So in the spinal cord, when you take the section of the spinal cord, there is a 31 segments are there. This is a one segment. So one segment means 31 segments means, so that segment contain the part of the spinal cord as well as it contain the ventral root and dorsal root of the spinal nerves. Then it form a spinal nerves. This is called the one piece of the spinal segment. This is called the TS of the spinal cord. Centrally gray matter, H-shaped. This is called the, see here, this is the dorsal horn of the, this is the dorsal horn of the gray matter. This is the ventral horn of the gray matter. These 2 connected by the isthmus. In the centrally we can identify small hole is there. That is called the central canal. That is called the central canal. It is a H-shaped gray matter is there. Outside to this gray matter, white matter is there. Here only we can identify the ascending and descending tract fibers are there. So that given in the textbook, just see there. Thank you.